Hello dear esteemed viewers, welcome to today's stories. Today we are looking at lives at risk. Top stories: Kenyans rise up due to failure to get HIV drugs. A surge in COVID-19 deaths and infections in India has made the rich fly to Dubai, while those without money can't leave, and flights to India from a number of countries have been stopped. In Kenya, activists on Friday the 23rd of April 2021 dismissed as public relations the government's statement on Thursday that it had resolved the issue and distributed the drugs to 31 of Kenya's 47 counties. The government said all counties within 5 days will have the drugs needed for 1.4 million people. We are assuring the nation that no patient is going to miss drugs. We have adequate stocks, Kenya Medical Supplies Authority Customer Service Manager Jeffrey Mwagwi said as he flagged off a consignment. He said those drugs would cover 2 months. The U.S. is by far the largest donor for Kenya's HIV response. Kenya's Health Minister, Mutahi Kagwe, told the Senate's Health Committee earlier this week that USAID had released the drug consignment that had been stuck in port. Patients are expected to receive them during the week. He said USAID had proposed using a company called Shamanics International to procure and supply the drugs to Kenyans due to trust issues with the National Medical Supplies Body. Bernard Baridi, Chief Executive Officer of BLAST, a network of young people living with the disease, said the drugs would last for just a month. He said the delay in distributing the drugs, in addition to supply constraints caused by the coronavirus pandemic, meant that many people living with HIV were getting a week's supply instead of 3 months. Many of those who depend on the drugs travel long distances to obtain them and may find it difficult to find transport every week, and if they fail to take them they will develop resistance, Baridi said. Adherence to medication is going to be low because of access. If we don't get the medication, we are going to lose people, he said. According to Baridi, children living with HIV are suffering the most due to the shortage of a drug known Caltra, which comes in a syrup form that can be taken more easily. Parents are forced to look for the drug in tablet form, crush it and mix it with water, and it's still bitter for children to ingest. Baridi urged Kenya's government and USAID to find a solution on who should distribute the drugs quickly, for the sake of the children. On Thursday, about 200 people living with HIV in Kisumu, Kenya's third largest city, held a peaceful protest wearing t-shirts reading "My Arms, My Life" and carrying posters that read "A sick nation is a dead nation and a killer government." Some 136,000 people live with HIV in Kisumu, or about 13% of the city's population, said local rights activist Boniface Agaduwakik. We cannot keep quiet and watch this population languish just because they can't get a medicine that is lying somewhere, and that is happening because the government wants to tax a donation, he said. Eric Okioma, who has HIV, said the government's attention has been diverted by the COVID-19 pandemic, which has affected even community perception. People fear even getting COVID than HIV, Okioma said, asserting that local HIV testing and treatment centers were empty. India's frontline doctors say surge in COVID-19 cases is tip of the iceberg. Thousands of Indians returned to the UAE this weekend before flights to the Emirates are suspended from midnight on Saturday. People who traveled to meet relatives, on business or vacation have snapped up tickets, often paying more than $1,088, 6 times the usual cost of a one-way fare. UAE authorities have said the decision covers all incoming flights from India for 10 days on national and overseas airlines. This follows the worsening COVID-19 situation in India. Some categories are exempt, including UAE citizens and diplomats, who are permitted to return as long as they adhere to quarantine and testing rules. Godly Babakati, an agent at Epic Travel in Dubai, said his team had handled more than 300 passengers who booked to return on Saturday on flights with airlines including Air India Express, SpiceJet and Indigo from southern India. I have a ticket but no test, so I cannot board the flight. The labs in this city do not have the code that the UAE requires. Dr. Rahul Gupta. All airlines have put on extra flights, because the requests have shot up, he said. A one-way ticket that usually costs DH600 to DH800 has soared to DH4400 from Mumbai to Dubai on some airlines. We have charged DH1700. These special flights go back empty, so the charges have increased. People are willing to pay because it's an emergency. They are worried they will lose their job if this lasts longer than 10 days, said Mr. Babakudi. There are also women and children coming back to be with their family. Dubai resident Kumari cut short a visit to North India for a niece's wedding when she heard the news. It was a limited celebration of 50 people that starts on Sunday, but I decided to get the first flight back to Dubai. It's not worth it to lose my job over this, she said, declining to give a surname. Several states, including Delhi and Maharashtra, have enforced strict stay-home restrictions to stem the spread of coronavirus cases. But smaller cities continue to allow gatherings of up to 500 people. Read more UAE updates regulations on India flight suspension. I can't sleep at night. Indians in UAE tell of fears for family back home as COVID-19 infections surge. India's total number of cases has crossed 16 million, the world's second highest total after the US. It recorded 346,786 new cases on Saturday, the biggest daily jump in the world, with 2,624 deaths in the past 24 hours. Several UAE residents said they were unable to get PCR test reports in time to make the Saturday deadline. Dr. Rahul Gupta, an anesthetist, who is visiting relatives in Agra, in North India, has informed the Dubai hospital he works in about the delay. I have a ticket but no test, so I cannot board the flight. We came to visit my mother-in-law who is unwell, but now I'm tense about how to get back to the UAE. Labs in this city do not have the code that the UAE requires. The India flight ban was announced on Thursday, days after Dubai updated PCR testing rules requiring a negative test result no more than 48 hours instead of 72 hours before travel. Results must be from an accredited laboratory that issues results carrying a QR code. The following pictures may be disturbing. If you can't stand them, don't watch, please.